Sarah, Gianna, should I dive in or should we go ahead? Okay. Welcome everyone. This is the CSDE weekly research seminar series. I'm Heather Hill. I'm a professor of public policy and governance in the Evans School at the University of Washington. And I'm also an executive committee member for CSDE and a proud affiliate. I am going to turn things over very quickly to our moderator today, Dr. Ali Rouhani Raybar, but let me first just give a few housekeeping notes. First, a preview to next week's session. We will have a presentation by Dr. Randy Akey, who is a professor at UCLA's Department of Public Policy and American Indian Studies Department. He will be presenting a talk entitled Immigrant Earnings Assimilation in the Age of Modern Mass Migration. So we hope you'll be able to join for that. Today's format is a little different than our standard research presentation. We're having a moderated panel discussion about COVID and intimate partner violence with a mix of both researchers and practitioners. And so I just wanted to prepare you that it'll have a slightly different feel to it. Still, we'll have the same practice of if you have questions or comments at any point during the panel, please put them in the Q&A rather than the chat. And our moderator will stop us at a certain point and switch over to Q&A, and we'll manage those questions for the panelists. So now it's my pleasure to introduce our moderator, Dr. Ali Rouhani Raybar. He is a professor of epidemiology and an adjunct professor in pediatrics at the University of Washington. He's an expert in injury and violence, especially as they relate to firearms. And he wears a number of hats at the University of Washington. He is an award-winning teacher, the co-director of the Firearm Injury and Policy Research Program at the Harborview Injury Prevention and Research Center, and is also an executive committee member for CSDE. So I'll turn it over to Ali.
Great, thank you very much, Heather. It's great to be here. Please let me know if you can't hear me well or any technological issues. I'm excited to be here with you all. Thank you for participating. This is an incredibly important topic. I think it's no news to any of you that the impact of the pandemic on different aspects of health, public safety have been profound. But domestic violence, intimate partner violence is one of them that has been truly impacted profoundly. Just a couple of nights ago, I was looking at PubMed and doing a quick search of PubMed, and very, very quick, dirty search of not very sophisticated, but quick search of intimate partner violence, domestic violence, and the pandemic. I found more than 450, 460 papers just on PubMed. And remarkably, there are already 6 or 7 systematic reviews and meta-analyses of this, which is quite remarkable when you think about the production of knowledge and the amount of time that this has happened. So, important topic, great to be here with you all. And we have 3 wonderful colleagues who I'm going to introduce, and then we're going to ask some questions. They probably are going to provide answers to each of those questions, 4 or 5 minutes, and then around 1:15 Pacific time, we will open it for Q&A. The panelists represent, as Dr. Hill mentioned, they represent practice, research, and policy. I'm going to start alphabetically. Dr. Avanti Atia is a postdoctoral scholar at the University of Washington. She completed a 2-year fellowship on an NICHD T32 pediatric injury training grant at the Harborview Injury Prevention and Research Center. She earned her SCD, Doctor of Science, in Social and Behavioral Sciences from the Harvard T.H. Chan School of Public Health. The goal of her research is to prevent domestic violence by understanding its causes and consequences, in addition to the role of policies and interventions in preventing and reducing it. Avanti has received a K99R00 Kangaroo Pathway to Independence Award from NICHD to study the effectiveness of state DV laws on school-based prevention and response in reducing the prevalence of adolescent domestic violence. Dr. Lindsey Bolinger is a faculty member in the School of Public Policy at Georgia Tech. Her research examines how public policies affect children and families' health and well-being, especially low-income families. Her research has been funded by the US Department of Health and Human Services, the Doris Duke Charitable Foundation, the Horowitz Foundation for Social Policy, the Spencer Foundation, and Pew Charitable Trust. And her work has been published in many high-impact journals. She earned her PhD from Indiana University. And last but not least, Dr. David Martin is a senior deputy prosecutor for the King County Prosecuting Attorney's Office here in King County. He serves as supervisor of the DV unit, co-manager of the King County Regional Domestic Violence Firearms Enforcement Unit, one of the kind, or the first one in the nation, and a Fulbright specialist. David is the recipient of many awards, the Prosecuting Attorney's Outstanding Trial Advocacy Award and Coalition Ending Gender-Based Violence System Change Award. He received his JD from Seattle University School of Law. So with that, maybe I'll just start the first round of questions. And I'm going to start with Avanti. Avanti, if you could maybe just tell us about what do different types of data tell us so far about the impact of the pandemic on IPV and some of the challenges, maybe scientifically and ethically, in studying domestic violence in the context of a pandemic.
Sure, thanks, Ali. So I think, as you were saying, there are so many studies that have come out recently on impacts of COVID on IPV, and with that, so many complexities to really understanding those impacts. I'll mention a few here. I'm sure Lindsey and David also have others that they can provide thoughts on, but a few that come to mind for me. So one is not really actually COVID related, but just a sort of general measurement of IPV is very challenging. So much of IPV is not reported officially. It requires surveys, interviews, intensive data collection efforts, and it's really hard to do that surveillance on a broad scale. So even pre-pandemic, I think we had a lot of gaps in surveillance of IPV, especially those non-fatal forms of violence that aren't reported. One example of this is that the CDC has a large-scale, nationally representative telephone survey called the National Intimate Partner and Sexual Violence Survey that is supposed to be this ongoing surveillance. But the last time they did it was in 2015, and that kind of timely national and state level data would be super valuable. I think some of the administrative data that may be more widely available, like medical data, police calls, arrests, official reports, are really important and tell us sort of one part of the story for individuals who are reaching out and seeking help and reporting, seeking medical care, but we're then missing individuals who are experiencing violence, but maybe not interacting with those services. And I think the pandemic has meant that certain types of violence are maybe even more hidden than before, with increased social isolation and mental health issues, folks not going into work and into communities where other people might notice or report things. And so I think, to me, all of this is leading to recognition that different sources of data sort of reflect different phenomenon, and that we need to triangulate data from multiple types of sources to more fully understand the impact of COVID. So, and trying to disentangle some of the effects. So one example I'm thinking of is that reporting rates reflect both maybe a change in the extent of victimization experiences pre and post pandemic, but also the help seeking decisions of those who were victimized before and during the pandemic. So it may be that folks who post pandemic, they might be seeking services for things that happened prior because maybe they're catalyzed to seek services because of increased severity or something else that was going on. The other thing in terms of data collection that comes to mind for me is this access to timely data, which can be really challenging. Victim service agencies are really targeted towards providing services for victims and aren't built for collecting surveillance data. And so may only have sort of one annual report. Like I mentioned, the surveys are resource intensive and very challenging and difficult to collect more routinely. So getting access to data in a timely fashion is challenging. And again, I think maybe skews some of the studies towards using certain types of data that are more routinely collected. And then two other quick things I'll say about sort of data collections and challenges is that I think COVID, of course, we know has impacted unemployment, school, absenteeism, housing stability, poverty, isolation, so many of these factors that are, definitively associated with IPV. And so in looking at the effects, I think trying to measure and understand those is critical. And then the last thing I'll say is that I think thinking about time frame is really important. So there are different studies looking at sort of that short time window right at the beginning of the pandemic when we were more in a lockdown phase, but longer term, the story might be different or more complicated. What does it mean that we're now 2 years into this with not a clear end in sight, and there's still all sorts of instability and stressors in people's daily lives? And so thinking very clearly, and if you're looking at a study, what time period are they looking at and what effects might be able to be detected in that time period with the type of data that they have.
Great. Thank you, Avanti. Maybe I'll go next to Lindsey. Lindsey, and we'll come back to some of the points that Avanti mentioned. And if any member of the audience also would like to elaborate, we'll touch on that during Q&A. Lindsey, your work and your scholarship has focused on the impact of policies on families and children. It's no secret that in the past couple of years, there has been a lot of interest in child maltreatment research and the impact of the pandemic on child maltreatment. The concern that child maltreatment occurrence may have gone up or may have stayed the same, but the reports have gone down. And we see that for domestic violence, the calls for 911 have increased. I wanted to ask you, especially because of the intersectionality of different types of violence here, domestic violence and child maltreatment, if you could maybe comment on that, especially in the context of how you think that the way that these two different forms of violence are being impacted by the pandemic. And also secondly, how do you think domestic violence against children is different from domestic violence against adults?
Yeah, this is a great question. So the first thing that I want to note is that there are lots of different parts to this question. So the first thing I want to note is that although we're hearing suggestive evidence and anecdotal evidence that child maltreatment or suspicions of child maltreatment, child abuse and neglect increasing, it's really important to document this with evidence, but it's also very hard to do so for many of the reasons that Avanti shared. A lot of those challenges are not necessarily unique to IPV, but they are universal across many forms of domestic violence, including child maltreatment. So the first thing that I want to note is that it's really important to be able to document and provide evidence for the many stories that we heard, especially early on in the pandemic. There were newspaper articles after newspaper articles of one family or two families. But actually finding this in the data has been really hard, and it's because of a lot of the measurement issues that Avanti noted. So just for example, if we look at child maltreatment reports to Child Protective Services agencies, they've just completely plummeted. And that's universal, that's everywhere. Many, many studies now have documented this. Similarly, if we look at other types of, whether it's substantiated cases or unsubstantiated cases, whether it's reports, whether that's calls to hotlines, there are many different ways in which we could measure calls or reports to Child Protective Services agencies, and they're all going down. So alternatively, what are some of the ways that we could measure child maltreatment? Well, if we look at things like injuries or abuse that's reporting to hospitals, we're not necessarily seeing what we expected we would see in particularly increases in physical abuse. That isn't really happening, at least in the data. And it might be because children and families are not going to the hospital in fear of contracting COVID. And so again, that's sort of a similar finding in that it's the opposite maybe of, or at least not producing evidence for the theory that was early on. Alternatively, if we ask people, if we survey people, they are pretty much showing us that, yes, things are very hard right now. And I, unfortunately, am taking it out on my kid, for example. So people are admitting to this in ways that maybe they wouldn't have in other surveys before COVID. Additionally, if we look at things like social media data are showing us something different as well than what CPS reports might show us. So there are all these different ways that we could measure child maltreatment, and they're all telling us something very different. And I think that's important, as Avanti noted, as researchers, when we are conducting these studies, to really triangulate the data, as Avanti noted, but also to really understand what we are measuring. To answer one of the other questions, Ali, that you noted, one of the reasons that this might be different, child maltreatment might be different from IPV, is that typically adult victims of domestic violence are the ones who report themselves. With child maltreatment, they don't report themselves, and most of the time they cannot report themselves, right? They're children. And so there is a required third-party involvement with child maltreatment. Now, usually the people who are reporting child maltreatment are people like teachers or police officers or healthcare professionals or neighbors. And in the early stages of the pandemic, at least, the contact to those folks was all but completely gone. And so when we don't have a reporter, someone to let someone know about child maltreatment, then of course we're not going to observe it, even though it may still be occurring. So the reporting issue here is really important when we're thinking about the distinction between IPV and other forms of adult domestic violence compared to domestic violence against children.
Great. Thank you very much, Lindsey. David, my next question is for you. And, I'm very familiar with your work. You've over 2 decades of experience here. I think my question is going to take you from local to global. I am familiar with the dashboard that you and your colleagues have created. I don't know how many of our audience members are familiar with the tremendous work that you have done. So I was going to ask you first to just set the stage and let us know what you have seen in King County during the pandemic in terms of the rise in homicide and what fraction of that you think is attributable to domestic violence. And then maybe getting ambitious and take you global and ask you if you could comment on what we're seeing at the global level. It seems to be affecting many, many countries around the world. And what are your thoughts as a practitioner of this for, about 25 years of experience?
I will do my best. And I should say, this is an intimidating audience for me to be in front of. You use the term doctor to introduce me. We should clarify it's a Juris Doctor. So I'm a lawyer. And, but I very much admire the work that's being done at the University of Washington, and Avanti and Lindsey's work is really important to the law. And I think the law has a lot to learn about the public health perspective of all of these things. And so kind of from my practitioner's perspective here in King County, the advent of the pandemic was an incredibly challenging time. It was awful, right? Just to try and do the work and be functional for a system that it's the law. A lot of it's paper-based. It's an in-person adversarial system. So that created a lot of challenges. And right when the pandemic hit, we saw a surge that was very real in our data. And you're right, and I'll put into the chat, my office is very committed to data. All of the things that have been said about data are critically important to us. And I think even from the if administrative data is more reliable than some other things, for someone who works with administrative data all the time, I can tell you it's not very good. It's very flawed. Even in King County, if you were to say to me, well, David, tell us, give me the statistics about administrative criminal justice data in King County. How's that changed over the last several years? Well, I can tell you about my practice, which is felony level domestic violence. We're the district attorney, so to speak, of King County. But King County is a big place. and to almost 2.5 million people who live here. And we have 39 cities. Each of them has their own city attorney, their own misdemeanor prosecution. So just this concept, there are thousands and thousands of misdemeanor domestic violence cases that happen in King County every year, 11,000 domestic violence incident reports. And then my office does about 15% of the incident reports of about, that are referred to us for felonies. And then we file about 1,200 cases a year. And then 2020 for us was the high water mark of our practice. So we had never filed more than 1,300 cases, and we did that in 2020. So there was this surge, and then a precipitous drop right after that. And my unit is fortunate in the sense that we don't just have kind of a standing in criminal practice, but also in civil practice. I see that my colleague, Angela Rognest, who runs our protection order advocacy program, which has been in existence for over 30 years and provides civil protection order services to the entire county. Fortunately, we had done some really great work to try and be remote. So that program was able to kind of the word of the pandemic pivot from an in-person paper practice to a remote protective order practice, which we were fortunate to partner with the University of Washington to study and examine. And was a really valuable way that we, kind of just practically speaking, keeping the doors open. We wanted people to have options. We know that civil protection orders matter a great deal, and we want people to have that option. And that led to a lot of different changes with e-service of orders and other things. But while this was happening, we saw this incredible rise of homicides in the years before. We had a very low homicide rate in King County for domestic violence. In 2019, we had 4 domestic violence homicides. And then in 2020, I had 18. And this last year, I had 16. And then, but the longer that we have looked at this, and this whole question of violent death has become something that, as you know, I've been a little bit obsessed with, is really understanding how domestic violence manifests itself in violent death in King County. There's a number of suicides in King County. We don't have a very good idea of which ones of those are connected to domestic violence. Washington does not subscribe to the domestic violence module, as I call it, in national violent death reporting, as some states do. So basically, it's left to interested people like myself to try and keep track of when we have domestic violence related violent deaths. And it continues to go on. Since Christmas, there have been 6 in King County. We've had 2 murder-suicides and a police death, an officer-involved shooting of a domestic violence suspect. So the violent death aspect of this is this massive takeaway for me, and it's so concerning, and it makes the work that we do surrounding firearms so important. And then it's also raised a number of questions on how are we engaging typically men in treatment. And this is a robust conversation in Washington on the fact that we don't support at all rehabilitation and treatment for men involved in domestic violence not covered by insurance. And this is, it's not just Washington, there are many states who don't support treatment for offenders. So there's a lot of questions. There's a lot of problems with the data. Those are things that, I've been fortunate to travel a little bit and do training. And I try and keep track of things that are happening internationally. And these are things that at least in my kind of practitioner experience, were mirrored in other countries. There's a surge, there's an upswing in intense levels of violence. And there's great concern for what now people are calling a shadow pandemic, the pandemic within the pandemic, and talking about domestic violence. And I think I'm heartened by that. Not because I think the increase in domestic violence, that's terrible, but that people actually care and want to do something about it. And that's complicated because I think people don't know what to do. And then when we really look at the data, because you can listen to lawyers like me, right, tell stories and anecdote. But when you really want to look at the data, the problem is the data, even in a place like King County, where we've tried to partner with Seattle King County Public Health and put as many data points out there as we can, is not good, and it's often misleading, which is why even on the basic question of how many people are dying attributed to domestic violence in King County, We don't know the answer to that. So I have a lot of concerns with what is happening, but I think it has also opened a lot of eyes, because now that we know there are data problems, we can address it. And the perspective that folks like yourself brings is really important, because I think that's been not absent, but not a fundamental part of what a system or community response to domestic violence has been.
I echo that, yes. Before I go to next round of question, I just wanted to echo a couple of things you mentioned. One is that, in the context of that population health initiative work that you referred to, what we found, for example, as one limitation in the data and shortcoming in the data was, when you want to do work that is centered around EDI and anti-racism, you need some good variables to be able to measure different aspects of racism, and they don't exist, or they are very, very incomplete. Even, starting with the variable race itself, which is not a perfect variable to begin with, but even that, at that level, it's not easy to collect. And so that's a problem. And I hope that this attention to this, as you mentioned, will result in some change in future years. So it's about 1:00. I think we still have 15 minutes left to do the second round. For the first round, I wanted to focus on the scope of the problem and just big picture in terms of the data. For the second round, I thought it would be great to focus on victims or survivors themselves a little bit here. People use both of those terms, as you know, depending on which one you feel is more appropriate. But Avanti, can you tell us a little more about what the research has shown in terms of the help-seeking behaviors of the survivors of domestic violence, victims of domestic violence, and how has that evolved over the pandemic? And what kind of things have been done that you think are definitely important to study in the future?
Yeah, thanks, Ali. So I think, as David was mentioning, there have been big shifts in service for people experiencing IPV locally, nationally, globally. One example of this is there was a review of measures that were taken in Europe that found that I think almost all, or I think all countries that they looked at enacted some type of measure to address violence against women and children during the pandemic. Most commonly, that was taken by the government and other nonprofit organizations, and largely using media and social media to raise awareness of domestic violence, but also providing services through online platforms like David was mentioning, maintaining hotline services. So there's lots of important ways I think that the services themselves have shifted. In a lot of ways, COVID has made it more challenging for people to seek services, for people to go to a victim services agency, to seek medical care, to seek legal help. They may be more monitored by their partners or feel like they don't have a space or privacy to take advantage of some of those services. And I think the move to online and remote services has opened up, I think, accessibility for certain people and also introduced new challenges in terms of technology and privacy and confidentiality. And so, like I was saying, and I think Lindsey mentioned this as well, but my read of the sort of ever-changing literature is that there are a lot of mixed findings on reporting and help seeking, largely because of data, but also I think one thing that I've been seeing pretty consistently is variation by location and the type of violence. And some of these findings might reflect what services are available and accessible during the pandemic. So one example is that there was a study in Philadelphia that showed a decrease in help seeking for sexual assault and assault in general, but not for intimate partner violence early on in the pandemic. And so I think that study spoke to the importance of distinguishing sort of different forms of violence. And then also they looked at calls to the police, calls to hotlines, and understanding which services were being utilized more during the pandemic. The other study that I'll mention is from Chicago that found that rates of police reports decreased after the stay-at-home orders, but that was largely observed in primarily Black communities, and there wasn't a significant change in primarily white communities, and that might reflect decreased domestic violence incidents, but it also might be reflective of exacerbated underreporting because of all these other social determinants that have been impacted by COVID. They also noted that the resources available decreased disproportionately in predominantly Black neighborhoods. So I think that's a really important piece to consider here. And so sort of with my research hat on, I think about taking these studies about help seeking and using this data to inform policy and practice more locally. I think given that there's so much local and regional variation, it feels like we do need, if we're thinking we're about providing programming and supports locally, that we need to have local data to really understand what's going on. And then we also know that the impacts of COVID have been, of course, felt very differently across different groups. So like you were saying, Ali, that need for disaggregating data by sociodemographic characteristics, race, ethnicity, socioeconomic status, language, all super important and all very difficult with, especially given some of the existing data limitations. But if we don't measure that, we're probably missing variation in these subgroups that might be important for resource allocation and identifying those who need more support.
Yeah, very well said. Thank you, Avanti. Lindsey, especially with your expertise in public policy, I wanted to maybe take a policy approach to this next question and ask you, what are your thoughts about innovative programs or strategies that the government have created to assist victims and survivors of domestic violence? Do you think they have been effective? What do we know about them? And moving forward, I mean, the pandemic is not over. Moving forward as a matter of public policy, how do you see this landscape of this?
Sure. So as in many industries, crisis often spurs innovation. And I think the pandemic has at least offered an opportunity for local and state governments to be creative in many dimensions. And so one way that local governments have responded to these surges in domestic violence is to switch up their response to assisting domestic violence victims or survivors. So just for example, some cities have especially in the early stages of the pandemic, when many domestic violence victims could not go to a shelter, for example, due to the perceived or the real risk of contracting the virus. So some cities set up an app, for example, that allowed survivors or victims to go to a hotel or go to an Airbnb. And this is something, we don't know the effects of this particular strategy yet. It's as Avanti and I have discussed the many data issues, particularly with getting fast data. So we don't know if these have been effective, but if they are effective and if they are also cost effective, then these seem like strategies that should, continue to be in play, once the pandemic does eventually subside. Similarly, there have been some changes to conducting court. And so, for example, some places have allowed the justice system to be more responsive to cases during these quarantine and stay-at-home orders. And so in particular, using electronic monitoring requirements and using virtual settings as many other industries have. And so similarly, if these are at least, serving a particular population, it's worthwhile to study whether they are effective and if so, for whom, and who's omitted from or who's being left out of this particular form of accessing. If these are effective and if they prove to be cost effective, these seem like strategies that there's no reason for them to be specific to the pandemic. And so, I think it's too early for us to tell, and at least from what I'm aware, we don't know whether these policies are, we don't know what the effects of these policies have been. But these pivots from local and state governments are really important and also really innovative. And governments aren't particularly known for being innovative, but this is one way that we should at least we should document whether these have proven to be successful and keep them around if so.
Great, thank you, Lindsey. So maybe before we open it for Q&A, and please feel free to put your questions in the Q&A section of the Zoom. I maybe want to end this second round of questions with one last question for David. David, King County is not one of the most low-resourced counties in the country. We do have resources in King County. I'm going to end with prevention. What are your thoughts about investments that we could make in this county and the planning that could be done to prevent this problem from happening and reducing at least its occurrence, especially in the setting that we have just experienced in those really sobering numbers that have increased in our county? I think you're on mute, David.
Sorry. It's a great question. And I think this is the real benefit of these conversations about data and trying to get to what is really happening, or my commitment to try and show the connection between domestic violence and violent death, not just kind of within domestic violence relationships, but as a community-wide issue. And we know collectively the impact of domestic violence on children and other things. And by the way, no one can tell me how many, there's deviant child maltreatment. No one can say the number of children who have witnessed domestic violence incidents in King County because nobody tracks that data in law enforcement, or they do in civil protection orders, but that's not usually public information. This larger question of what do we do to respond to domestic violence, I think is so important, because for so long our response has purely been either criminal justice or legal, or I'll say social service and non-governmental organizations, right? There's no Department of Domestic Violence at the UW. There's no people who are in charge of developing the best treatment practices to rehabilitate offenders in major research institutions across the country. And prevention, there is not state, county, or city investment in prevention. There's just not. There is probably a handful of maybe a few $100,000 here and there, but there's really some wonderful prevention work going on. And so I think if we're going to have an honest conversation about this, those are all things that would make a difference in the community, but they are terribly under-resourced. They lack infrastructure, and we don't have a way to kind of put them in play. And I think they're oftentimes it's, there's a lot of things that have to happen along the way. And there's some great organizations happening in King County. There's a group called Team Up Washington that I'm a huge fan of, and the work of the state coalition, the Washington State Coalition Against Domestic Violence, that does a program called Coaching Boys into Men for young men, does prevention, domestic violence and sexual assault prevention with young men, and a program called Athletes as Leaders, developed by the University of Washington and Harborview for young women. I love these programs. My son is in Coaching Boys to Men right now at a local high school, and my daughter has gone through Athletes as Leaders. But those programs are few and far between, and the schools that do them with no support from local government. They do them on their own, out of their own kind of education and time and commitment. I'll put an op-ed that I wrote about this with my colleague Ben Santos, who manages our sexual assault unit, with just a very basic kind of statement to the community that we want fewer cases. Really, maybe the worst moment for so many people, defendant, victim, survivor, and their families, is to meet somebody like me, right? That means a felony level incident has happened in somebody's life and they face either enormous consequences. They face enormous consequences no matter what, and it changes everything for them. It's not a good thing that people know me. And as someone who grew up in a home with domestic violence, back before mandatory arrest and back before all of these things, I don't want that for anyone. We want less of it. And so that means working with children and working with communities and doing a lot of the investment, which is talked about. But when we ask what are the values that we have as a community, the first thing that you need to do is say, show me your budget, right? What's your budget? How much money are you putting towards this? And when the number is zero, both for prevention and rehabilitation, that's not good. So I think it's a serious gap. It will take a long time, I think, to show the results of that. But I can say and I'll just say this because I'm sorry to take up time, but having participated in coaching boys into men's sessions with sports teams of young men and things like that, it's powerful. It is powerful stuff to be in a room with coaches and young men talking about how do you manage this emotion and this thought about aggression in relationships. When we're telling you to be aggressive on the field, right, we're promoting and we're demanding aggression from you. And then in your day-to-day life, how do you as a young man deal with aggression in other areas of your life, and having just really thoughtful and practical discussions with young people about that. So I think there's a lot of great programs. They need support, and it shouldn't just come from like private fundraising. It should come as part of a large plan to address this. And it just shows to me that right now, still domestic violence, sexual assault, and related issues are second class in the investment that they get and the priority that they are given. And if there is anything that will come from this pandemic, is my hope, is that it will elevate the need to respond in a first-class manner to these things.
Perfect. Thank you, David. And time-wise also, it's perfect. It's about 1:15, so we are where we would like to be. If there are any questions, please type them in the Q&A section of the Zoom, and I will ask them. Are there any other thoughts, David, Avanti, Lindsey, that you wanted to share with the audience, or Heather, Sarah, if you have questions for the panelists? I do have a lot, but I wanted to make sure that you all get a chance to maybe comment on something that maybe you were not able to comment.
I mean, I would love to encourage Avanti and David and Lindsey, if you had things to say in reaction to each other's comments, that would be good.
David, when you were describing the lack of data on, for example, children observing or witnessing domestic violence in King County, this isn't going to be perfect, but there is a database out there that does allow for this kind of counting, or at least documenting something similar. And so the National Survey of Children's Health asks parents if their child witnessed domestic violence. So the closest thing that you can get is sort of the statewide estimate, but there are data sources that are starting to pay a little closer attention to this.
It's such an important issue. I've done some of the work that I've done in Europe. It's so interesting to go to places where just the witnessing of domestic violence, children, you're considered to be a victim legally in Europe, right? And here, the witnessing of domestic violence, like, no, you're not, right? There's a lot of things that go with that. And so all the resources that are devoted to children in Europe, where, it's still such a large gap in how we're addressing children who witness in this country, and the services that are available for them. And then just the larger fact of, like, you would like to do this on the front end. And for even how we respond. Washington's a mandatory arrest state, right? As many states are. But no matter what it is that we're talking about, when police respond often in the middle of the night to a time of great emotion and crisis in a family, there's no one who responds with them, right? There's no services that are available for people at that time, right? So this idea of how do we support, even when people are calling for help, what do we do, right? Well, it's very reactive. We're gonna have CPS. That's what we do for children. And for victims, survivors, it's a list of phone numbers to call when business hours are available. And that's been true for 4 decades in this state.
Not only is it responsive, but it's also normally punitive instead of rehabilitative.
Yeah, that's right.
That's right. That's a good point. There's a question in the Q&A, and you all the panelists may see, but I'm going to read it to make sure the audience knows about the question. How does IPV affect access to COVID prevention measures, like vaccination or masks? So it's an excellent question by Kara, because sort of asking the impact of IPV on measures that have a bearing on acquisition of the risk of acquisition of the virus. Do we know from research or from the reports so far how IPV has affected COVID-related prevention behavior? Does anybody know? Have you seen anything?
I haven't seen a lot, but I did see one interesting paper that talked about potentially, as part of sort of controlling behaviors that one partner might use, that they might limit access to vaccines or sort of control when somebody gets vaccinated, when they mask, if they mask, all of these things, and maybe even use sort of fear of getting COVID and the reality of potentially getting COVID as a reason to sort of keep somebody in their home and sort of under more control. So that's something I've seen a little bit of, but I haven't seen a ton of research on that yet. But I think it's a really interesting new manifestation, I think, that could be something to research in the future.
I totally agree. I mean, there is a robust body of literature, as you know, on the impact of violence and variety of different infections and infectious diseases related behavior, vaccination, the impact of conflict and violence on those. But this is a great question within the specific context of COVID in relation to IPV exposure. That would be something to really look at in the future.
It's almost like it's its own new form of abuse, right?
Right. Lindsey, one thing I wanted to ask you is, which we didn't get a chance to talk during the rounds of questions, and we still have about 10 minutes left. And Avanti mentioned this, but I wanted to see if there are opportunities to elaborate a little bit more. All different sources of data on domestic violence, the hotline, the calls, the social media, ED visits, and all of that, they may paint different picture of this, or different scope of it. Where have you had thoughts about how to potentially use all these disparate source of data? Is there a way of triangulating them, or is there any way of making sense of this heterogeneous group of data that may show different trends of IPV during the pandemic?
Yeah, I think it's really important to view the body of research as opposed to one particular study or one particular paper or article, because of the various ways in which these data are measured and in which they transpire and are recorded. They tell us something very different about these experiences. And so I think it would be very flawed for either policy to be making decisions off of, or for people to be using one study or one article or even just a subset to be making decisions off of, and to be sort of informing what to do about the issue. So I think it's important to focus on the body of research as opposed to each individual. And I think this very specifically, I think one distinction, which is a very tangible distinction here, is when we think about reports to whether it's child maltreatment reports to CPS agencies, or whether it's domestic violence reports, as opposed to 911 calls, for example, which we know reports have declined. If we think about those types of reports compared to, say, for example, social media data, particularly in the time of the pandemic, have, I think, become much more important in terms of studying this topic, because so many people turned to the internet and turned to their social media accounts as a way to connect with their communities that they couldn't reach otherwise. And so it's sort of, elevating the importance of other sources of data than maybe more traditional sources of data. But again, I don't think I think it would be a mistake to solely look at things like social media data. I think it's important to put all of the pieces together. And I really encourage anyone who's in decision-making capacity to do so, because I think they're telling us very different things.
That's a great point, right, about social media. The way that people may be expressing this now, in lockdowns and new forms of lack of social connections. And I hadn't appreciated that the way that you said. So thank you for bringing it up. Heather, I think you may have a question for the audience, for the panelists.
Yeah, I had a question for the panelists. I think you've really made clear how confusing and inadequate the data is in this area, especially for understanding how things have changed with COVID. I'm curious if you were to go back in time and be able to predict that we would have a pandemic and that, the economy would shut down, and et cetera, putting aside all the other ways that would have been useful thing to know. I'm wondering, from the perspective of thinking about domestic violence, what you would have expected would happen, what your sort of priors would have been about how such a public health crisis and an economic crisis would play out in terms of domestic violence, and whether that helps us maybe, think about what we're seeing now at all.
I think we would have predicted a huge surge in domestic violence. And in many ways, some of the data are showing us that. I thought this question was going a bit differently. I thought what you were going to say is, what sort of data would you want, if you knew the pandemic was coming? And I was going to say, we all need an app on our phone, right? Just a ping, a quick little ping. I'm in need of help, right? Because one of the problems with domestic violence help seeking is, for example, shelters and other advocacy centers see surges on Mondays when the violence happened over the weekend, because that was the first chance they could escape the perpetrator. And so if you are now all of a sudden stuck with the perpetrator for a very extended period of time, how do you alert someone in sort of a, very secret way that you need help? And so had we known the pandemic was coming, I would have invented that app.
Yes, that's a great question, Heather. I don't know if Avanti and David have any reaction to that question. I would just say that to do that forecasting and that prediction, sometimes so complicated. We, as an example right now, as we're doing research on homicide and suicide, as David mentioned, that's a puzzle on its own, because homicide rates have gone up in many parts of the country, but not all. And so some cities, big cities, have been affected profoundly. Some big cities haven't. Why? We see an increase in rates of some of the risk factors for suicide, but we don't see an notable increase in rates of suicide. Why? So there are just so many questions that I think is really ripe and ready for future years to tackle them. And hopefully answer to those questions can give us better modeling approaches for the future to predict exactly what Heather mentioned. Any other questions from the audience or any other final thoughts in the next 2 or 3 minutes?
I guess I would add off of Lindsey's comment. It's interesting that the criminal justice system is often, I will just say primarily dealing with marginalized people, right? We see a lot of people who are impoverished, and we have a lot of victims who don't engage in help-seeking behavior. And a big challenge is, yes, there are many victims who engage in help-seeking behavior, but there are many marginalized victims who almost by definition don't. And these are typically, anecdotally, but maybe Avanti and Lindsey know that research about this, the women of color with families, right? And so understanding kind of what is really happening with domestic violence is just very challenging, because the people who I want my unit and my office to reach most are the hardest to reach for lack of trust, which of course, but also because we ration and we triage cases based on who asks for our help and who doesn't, right? If you ask the right way, if you know how to navigate systems of bureaucracy, either in government or an NGO or in other circumstances, you'll get some measure of relief, whether it's civil legal aid or whether it's health or any type of service. But if you're not help seeking, right, you're not going to get those things. And that's just how we do business. So even our entire model of how we provide services, I would suggest is flawed. That we don't measure or provide services to those who are at greatest risk and greatest need, or those who are most marginalized. So again, this need for kind of data and other things is so critically important because we don't understand. I would have loved to hear when the pandemic was hitting what 911 calls were saying. Like, what are people actually saying on the call? Not the fact that they called, but on the call systematically across an entire jurisdiction. We actually tried to do that, and it made a lot of people in 911 centers across my community very upset, because it was a massive amount of work to try and make that happen. But I think this idea of becoming more sophisticated, more progressive with how we are responding to such important issues comes back to this. It has to be a first-class response. And that first-class response has to begin with what's actually happening, right? And are domestic violence offenders just killing, in homicide, their loved ones and their family members, or other people in the community? Like, we're able to look at that now. They don't just kill people who are close to them. There's violence that runs across the gamut. And that also presents challenges for how you treat and rehabilitate offenders where the risk of violence is so high. And is our treatment intervention kind of really up to what it needs to be to respond to this problem? So my hope is that coming out of the pandemic, if going into it, we had any prediction, I guess my hope in all of it was that coming out of it, we learn lessons and we try and apply those and try and get better in the future.
Perfectly said. Thank you. Well, Gianna and Sarah, I think we're right at time. Thank you all for joining today. I mean, this is a big problem that we're all trying to contribute to its solution, but definitely keep us posted with any thoughts or creative ways of thinking about this. I hope that you found this to be helpful. And I hope to see you again in future seminars and series like this.
Thank you for organizing it, Ali, and thank you, Heather, too. Thank you all, our panelists, that we've gotten a lively little set of ideas here in the chat box. But this question of data for social good is really, really crucial. And I hope we at UW can be innovative and figure out ways to make this work and improve what we have. Measurement, data collection, data integration, et cetera. So We can do it, I think.
Absolutely.
Thank you.
And
all
on a
for
positive note.
participating. And thank you, Ali, for moderating.
Of course. My pleasure.